Hi everyone. Today I am going to go over some of the key points regarding hygiene that I put together during my research. As professionals, we all know that poor personal hygiene can lead to many negative health complications. Poor oral care can lead to increased caries or gum disease. Poor body hygiene can lead to lice or skin infections. And poor hand hygiene can lead to unnecessary exposure to diseases and increased risk for infections. Healthy People 2020 set forth a goal for primary and middle school children to increase the number of health education programs to teach good hand hygiene and to promote health and wellness. Within the confines of hygiene, I will quickly go over oral care, hair care, and good hand washing. Poor oral care can lead to a plethora of problems for a person. Swollen, bleeding gums, pain, tooth decay, and jaw pain are all possibilities when oral care is not completed over a period of time. According to the World Health Organization, many of the risk factors for periodontal disease are often similar to those of major health diseases. There are prevention programs in place that focus on education of parents, teachers, and children, as well as daily brushing 3 times a day. Other programs are also encourage the use of fluoride-based paste to restore or prevent any damage or extended damage to the enamel. Other programs include recommendations for annual or biannual dental exams along with atraumatic restoration treatment. You may be wondering, where does the nursing community fit into the scheme of oral care? According to Wilder, one of the articles that I found during research, in order to promote collaboration of teaching oral health care, it is important to educate the nursing profession. The education would include how to assess oral health and know when to refer the patient to a dentist or dental hygienist. As indicated in the article written by Wilder, the dental profession and the nursing profession need to collaborate more since the nursing profession has proven to be so successful in the promotion of illness and disease. Most former students in the United States remember having a day where their school nurse came in to check their head for head lice. In elementary and middle schools across the United States, there are many outdated programs implemented regarding hair care, especially with regards of treatment of head lice. Many schools have a no-knit policy that is very truly outdated. But school nurses are fighting to change this policy. And in order to do so, they must educate those throughout the educational system. School nurses are attempting to lead a movement to re-educate those and update the outdated policies to evidence-based interventions that are leading for better attendance and less outbreaks of head lice. Some of those programs in place include education. First, the education about myths surrounding head lice is a must. For example, the no-knit policy is not in accordance with the CDC or the Center for Disease Control and Prevention recommendations. Current policies also suggest sending a child home and sending a note home with other students. That practice actually violates the privacy protections of the student that was found to have lice. The CDC states that lice are not jumping, flying, crawling distances to spread to others. It is also stated that the transmission is most likely from head-to-head contact. Lice are not spreadable from animals to people or vice versa, and while sharing hair care products is not recommended, the likelihood of transmission is minimal since the lice are built to attach to only hair follicles. What is important regarding hair care is that it is true that more lice are found on heads that are not shampooed or brushed often. So we must educate others to wash and brush their hair. In addition to hair care, daily bathing with soap is suggested to lower the chances of skin irritation or other illnesses in children. Now let's move on to another subject that we as nurses may feel is overused. The CDC states that the best way to prevent the common illness or any common illnesses such as pneumonia, diarrhea, antibiotic-resistant infections, or hand, foot, and mouth disease is to use good hand washing technique. As professionals, we are taught good hand washing technique from day one and the importance of good hand washing technique. For those reasons exactly, that is why this subject will always be part of our continuing education. Of all personal hygiene routines, hand washing is the most important act in fighting bacteria and illness. And according to the CDC, it's also the most cost-saving step in fighting illness. According to the World Health Organization, the lack of hand hygiene programs and education is a problem from all settings, ranging from schools to hospital settings. And unlike other personal hygiene rituals, hand hygiene should be done multiple times a day. While the subject may seem trivial to some, hygiene is very important to our health. And as a nursing profession, we need to continue to give the gift of education and educate them on the importance of hygiene. I also did my presentation on hygiene, and I did this with students ages 3 to 6 for pre-kindergarten and kindergarten class. In order to do my presentation, I was able to ask during my presentation the level of knowledge that they already had. And I started with, what did they know about germs? Did they know that germs were good? Did they know that germs were bad? Things like that. I presented a slideshow, and while most of my students weren't able to read the slideshow, it was very interactive, and I had colorful pictures, and we did a lot of questions and talking to each other, as well as showing. We did a lot of teaching with our hands and showing them what to do and how to do it. I also quizzed them on times for things like hand washing and teeth brushing. But I'll give you a little sneak peek of how my presentation was set up. First, I asked them a question: what do we do to stay clean? I asked them multiple times, and most of them were able to answer quickly that they took a bath or a shower, and that they brushed their teeth. But with a little prompting, they were able to tell me that they washed their clothes, brushed their hair, and washed their hands. My next slide also included if whether or not they took a bath or a shower, and we talked about that. The girls, most of them said that they showered, and most of the boys said that they bathed. Then we moved on to hair care, and I asked them, how much soap do they use? Because we all know that children like to overuse soap sometimes, and I did explain to them that less is more. And I showed them this slide. I showed them that how we wash our hair, because I also found that many of the students did not wash their own hair. Their parents did. Most of the students in the classroom were girls. So we went through and we kind of talked about what the steps were. We moved on to oral care, and I talked about the dentist and what the dentist does. I asked them if they had been to the dentist, and everyone had. And then I asked them what the dentist did for them. Most of them were able to answer that the dentist brushed their teeth or cleaned their teeth and counted them, which was pretty awesome for them. They were very excited to share that information with me, because a lot of them had just went for a checkup. There were 7 kids, I believe, that are getting ready to go into kindergarten and had to have that checkup. Due to technical difficulties, the video that I had in my presentation was not able to be seen. So I was able to have a backup, and we used a book that was sponsored by Crest. And we went through and we talked about the germs. They were the bad guys, and the toothbrush was the good guy, getting rid of the bad guys. The next thing that I did was I focused on hand washing, and this was probably the best part of the presentation for them, because this is where they were more interactive. They were able to get up, stand in line, and we went through and I did a glow germ presentation. That's where we have the black light lotion and the black light, and you stick your hands under the black light and see where the lotion is, because that is the germs. And then you go and wash your hands, come back to the black light, and see how well you wash them. I went over and showed them what we have all seen many times, how you wash your hands, and I went through and I asked them multiple times how long they needed to wash their hands. I got answers from 10 seconds to 30 minutes, and they learned very quickly that 20 seconds is a very long time. Part of the glow germ presentation, I was able to provide the students with a coloring sheet, and at the bottom of it, it says, "I pledge to wash my hands." They all promised me that they would wash their hands each day before meal at school. Part of my community project also included knowing who I was giving my project to. I had um, pre-K children and kindergarten children. Pre-K is split into two groups. I had pre-K 3, which are 3 and 4 year olds, pre-K 4, which is 4 and 5 year olds, and kindergarten, which is mostly 5 and 6 year olds. Out of 15 normal students in that class, 13 were available for the day of my presentation. 7 were girls and 6 were boys. 12 were Caucasian and 1 was of African American descent. 11 were from nuclear families and 3 were from single parent families. It was a very small class. It's a private school, so most of the students actually were from upper class. I had 2 families from the working middle class and 2 families from the upper middle class. Of course, diversity was minimal. The fun thing about teaching children is I could quiz them on and off throughout the um, program. When I asked them how long we brush our teeth, the book stated that we brush our teeth for 3 minutes. So when I got to hand hygiene, I asked them if they were able to remember how long they were to brush their teeth, and they were able to answer correctly. Um, After we did the glow germ presentation, I asked them again how long they were supposed to wash their hands, and they were all able to reiterate to me that they are to wash their hands for 20 seconds. I also got a lot of compliments on how well I was able to teach and grasp their concept. I was there for an hour. My presentation took an hour long, a lot longer than what I thought it was going to be. I didn't think that there would be so many questions, but when you have a group of 3 to 6 year olds, you never know what you're going to get. That is one of the things that I learned. Um, my students were very pleasant. They were very well behaved. And for 3 to 6 year olds, that's pretty impressive. Um, I guess that is pretty much it. And I will go ahead and show you the references that I pulled. Here those are. And that's it. Thank you.